Yeah, I mean, clearly the pandemic and the lockdown response has affected everyone in society, but I think it's becoming clearer as we do more and more research that really what's happened is the existing inequalities in society have largely been exacerbated. So for people with severe mental illness, there has been the isolation and loneliness of having to self isolate has been a big impact. The other thing for a lot of people is that routine and self management techniques that we use to keep ourselves well quite often involve things like being out and about, going to support groups, meeting with other people, basically all of the things we've not been able to do through the pandemic. So that clearly has had a kind of undue impact on a lot of people's mental health, in that many of the services and the supports and the interaction with other people that we would normally be used to as part of our day to day life has pretty much disappeared over the last, well, almost a year for some people.
So Gordon raises some really important points there, and I guess that speaks to the broader lessons of the pandemic. So we know that COVID, as it's affected the population in this country, it's disproportionately affected some of the most socially disadvantaged groups in the population. And it's amplified the health inequalities that Gordon has spoken of. So it's not an equal opportunities thing, COVID. And so all those things that we know about broader society that COVID has taught us are amplified several fold amongst people with the most severe forms of mental ill health.